Good evening, everyone, and welcome to the Montgomery Township Board of Supervisors meeting for April 27th, 2026. I'm Tanya Bamber, Chair of the Board of Supervisors. On behalf of my colleagues, welcome to everyone here and at home who is watching. I'm going to go ahead and call the meeting to order. Please rise and join us in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Moving on to public comment. Any persons wishing to make public comment during this meeting on any items not listed on the agenda may do so at this time. Please come forward to the microphone and state your name and whether you are a township resident or business owner. Kindly keep your comments to 3 minutes. Thank you.
Jay Washewski, Pinecrest. Had two quick comments. One, the fire department. A couple months ago, when it was decided to hire the consultants, one of the objectives was to have a early assessment of our manpower. So my comment is, would like to hear if there's been an assessment by the consulting company, how immediate our current manpower needs are in the fire department. I do understand that there's several more months left before they get back with us with their study about the whole facility and everything, but we did discuss in January asking them to give us a quick assessment on the manpower of the fire department and how urgent we might have a shortfall. And then my second item is the budget deficit. I intended to go to the finance meeting last week, but my knee wasn't cooperating. So I went to check if there were minutes on it. My comment is I don't see minutes being posted on the website. And maybe I'm searching the wrong way, but nothing was coming up for any minutes from the finance committee, because I'm curious to see if we're addressing the budget deficit overall. And then my last comment is, and I probably should have brought it up at the last time I was at the meeting, was we're spending $1.5 million upgrading Whistle Stop Park. And I don't understand that with a $6.5 million deficit, why we're spending that money on there. It doesn't seem fiscally responsible to me. Thank you.
Thank you for your comments, Mr. Washewski.
And this goes to a comment made by Beth, how EVs are the future. And, that's why we need that EV charging station. Porsche, delaying EV models, extending gas lineup. Ford, challenging canceling EV models, delaying launches, $50 billion in EV losses. General Motors, delays restructuring EV investments, billions in losses. Stellantis, which is Chrysler, Dodge, Jeeps, Ram, Fiat, again. Major delays canceling models of EVs, $26.5 billion in EV losses. Honda, abandoning full EV transition targets. Mercedes-Benz, revising EV targets downward due to global scaling back, $75 billion in EV plans. Volvo, delaying U.S. EV launches, canceled U.S. launch of EX30. Okay, Nissan, scaling back EV ambitions, listed among automakers walking away from EV plans. Acura, pulling back EV commitments, included among brands reversing EV plans. Volkswagen, halting U.S. EV production, ending U.S. production of ID.4. This is from Autoblog. I think that's more reliable than you're saying that's the way of the future. Just so you know.
Thank you.
And hopefully you can make informed decisions.
Thank you for that feedback. Any other public comment at this time? Hearing none. Moving on to the consent agenda. I will move to approve the consent agenda as presented for the following: the minutes of the April 13th, 2026 Board of Supervisors meeting and payment of bills for April 27th, 2026. Is there a second?
Second.
Any public comment? Hearing none. All those in favor say aye. Aye. Any opposed? Motion carries. Okay, now we have a presentation. We have the VMSC Emergency Medical Services Operations Update. Carolyn McCreary, Township Manager.
Good evening. Shane Wheeler, who is the Chief Executive Officer of VMSC EMS, is here tonight to provide the board with an update on their operations.
Good evening.
Good evening.
I was told I had to get really close to this. So, first off, thank you for the opportunity to address the council board. Sorry, but it's always a pleasure, right? Our relationship with Montgomery Township in my tenure has been just phenomenal, right? You've led the way for other municipalities to follow, right? Your support of our organization is much appreciated, right? And the support goes beyond our borders. I'm going to explain a little bit about that today. Some of the operations, particularly in Chester City, which I know has been on the minds of this particular community, and I'm happy to report that great things are really happening there. And so we built a really good presentation, or I should say Bryson's done all the work, heavy lifting here. So kind of go through this. So last year we ran just under 2,000 responses in the community, 1,967 to be precise. He's got to make it bigger for it. Thank you. We transport approximately 76% of those, which is on par nationally and with the transport rates that we see across the United States. With about 15% of those were refusals, and about 8 there's no patient found when we get there. The top responses, as we see in many of our communities, sick people is kind of like a general catch-all kind of category, but falls. Falls are what I would refer is an epidemic amongst our populations in the United States. As the silver wave, continues to kind of crash into things. I'm now getting to that category of demographic. We're seeing a lot of falls, right? And as I've said to this board and just about every other people that'll listen, it's something we have to address in our communities for public safety. The impact of a fall is incredible. Studies show that 50% of people who fall are dead within a year. Dead within a year, right? So it's that point, the tipping point. We've all known that person that gets along great and they're doing well, and suddenly there's a fall, and then their whole life is turned upside down. So it's something we're really focused on and trying to develop programs in mitigation and education and training and how we create more safety in our communities. Our average shoot time from dispatch to the crew is actually in route on call is about 29 seconds. We're really pleased with that. And our response time, trauma call to on scene in Montgomery Township, is among the best in all of our operations, only second best to Chester City, which we have under 6 minutes so very, very good there. We're shifting our mindset around from the typical metrics and things that we've looked at in the past is, that response time, that, transports, non-transport. We're really trying to change our focus to more of a value-based care model, meaning from time of injury, insult, incident, symptom to intervention, right? And working on the total patient and finding ways to have longitudinal record sharing to where we know that the care that we're getting and that we're getting them to the right places is the right care for that particular patient, right? So really shifting. Response times are important, certainly, but only 8% nationally of calls to EMS are truly critical that need, lights and sirens run as fast as you can to get them to the hospital. And 20% of 911 calls across the United States are repeat callers. So people who have called multiple times for those services, as I'm sure we've all experienced either on the fire side or law enforcement, where we have those high utilization populations. So focusing on, STEMIs, which are heart attacks, ST, elevation, myocardial infarction, if you're ever curious what that means, stroke, overdose, and pediatric care. This is our shift as an organization, which we think we should really be putting a lot of energy and effort in, and also trauma care. These are the calls that every minute counts. Our decisions have to be spot on, and our treatment patterns and methodologies, and our real energy and effort is going to be surrounding these areas. Happy to report that 7 people in Montgomery Township last year survived a cardiac arrest event. That is not attributed to VMSC alone. That is attributed to our partner agencies, the police department, who are slapping, as you guys know, slapping AEDs on patients, and fire department personnel, and just the general community that steps up in those situations in cardiac arrest and starts CPR. Your cardiac arrest ROS rate, which is the measure we use, return on spontaneous circulation, they get a pulse back, is right at 41%. That's twice the average in than the Commonwealth. So that's fantastic numbers. Hold on. 2 residents of Montgomery Township are here today, right, because they received whole blood in the field, right? So just to reiterate, there are only some 360 EMS agencies in the United States and communities in the United States that have the capability of their EMS systems to transfuse blood. Less than 1% of all the EMS agencies in the United States. And we have that capability here in Montgomery Township. And it's truly making a difference in our communities. Beyond our borders, I mentioned Chester City earlier, and there's some things that I wanted to share that we're trying to work with. We have solidified some certainty in a community of lots of uncertainty. We were able to successfully navigate the financial situations, the gaps in care, and what it costs to deliver care, and what the community could afford to pay for that care. And it's about a net zero, there's for sure, right? But that's okay, right? Because we're providing superior level of service for a community that does not have a hospital, right? And probably will not have access to one for probably another 3 years. Beyond that, we're working with Nemours and on a pediatric outreach clinic in the community. We're actively working with Trinity Mid-Atlantic, which operates St. Francis and St. Mary and Mercy Fits hospitals on outreach clinics within the communities, and also providing preventative care, because so many of the people that live in these communities don't have access to preventative care. So figuring out ways through shuttle services that are operated by volunteers and at no cost to get people back and forth to their doctor's appointments and establishing them. And we're working really hard on education in the community, because the access to preventable medicine and care, quite frankly, the skepticism surrounding the healthcare that they've had to endure and continue to endure in the communities has created challenges for people that just can't get care. So we're constantly responding to calls that are not necessarily what should involve an ambulance. So working with community health paramedics and so forth to be able to connect people and break down barriers to care, creating more care parity for a very vulnerable population there. More locally, we've been in working with the unhoused population here in the North Penn area, particularly, and have done some outreach there and working with some folks in Lansdale to ensure that very vulnerable population gets access to appropriate care and so forth in their transition facility in Lansdale. We're working with their staff to ensure that when a new person comes into their facility, that they get access to a health screening by one of our nurses. We have 8 registered nurses that help us with mobile health, and they do a health assessment, take labs, and so forth, and make sure that they're getting the care that they need as well as multiple workforce initiatives. I'm really pleased. Currently, we have 108 students in 3 different campuses from Upland, just outside of Chester City, Hatfield, and in Philadelphia, where we're providing EMT and advanced EMT training as well as paramedic training in our local operation here. So happy about that. We're pleased to announce some partnerships. Villanova University, we've been working with them for about a year on the development of a leadership certificate program that emphasizes culture, psychological safety leadership, because we have really the workforce that we have today and the type of work that we do in emergency services requires a special touch in how we manage our staffs and people to ensure that they're going to get a good, healthy, long career in the field. And if we don't invest in that, then the burnout rate is pretty high in the work. So we're happy in those relationships. Manor College have accepted our educational programs for recognition towards degree, associate degree in paramedic science. So really trying to build up opportunities within our workforce to get what they need right here for professional development and keep our people here and not looking other places and going other ways to do that. And then obviously we do a ton of public education from car seat safety to CPR training, stop the bleed with our law enforcement partners. So heavily engaged in those things. So we have a video that we're pretty proud of to talk about the SS4A grant, the Safe Streets for All initiative that Montgomery Township sponsored on behalf of the North Penn municipalities and in the Valley municipalities that supported this endeavor. So I'll let you start that.
Every day, roads in the North Penn and Indian Valley connect families, workers, students, and first responders across our community. And when a roadway emergency changes a life in seconds, VMSC is there to help turn crisis into survivability. Sponsored in partnership with Montgomery Township and VMSC Emergency Medical Services and supported by all North Penn and Indian Valley municipalities, VMSC was awarded a $2.4 million federal Safe Streets and Roads for All grant through the U.S. Department of Transportation. This 3-year effort will strengthen roadway emergency response across our communities. The federal Safe System approach defines post-crash care as the moment injured people rely on emergency first responders to quickly locate them, stabilize their injury, and transport them to medical facilities. These 6 initiatives are how we answer that call. Together, we have created one practical roadmap, led through partnership and designed to improve preparedness, response, care, recovery, and long-term resilience. It starts with a trauma-ready workforce. Hands-on training builds sharper judgment, stronger coordination, and steadier hands when the call comes. To get there, we're investing in simulation equipment, bringing high-fidelity mannequins and virtual reality directly to our crews in community classes. Real scenarios, real practice before the real emergency. It also strengthens safe response, from smarter scene operations to advanced vehicle technology. This initiative is focused on protecting both responders and the public, so crews can reach patients safely and everyone gets home at the end of the shift. That includes a mobile ambulance driving simulator for real-world driver training, upgraded 4-wheel drive F-Series ambulances to dramatically improve patient access during severe weather and on difficult-to-access streets, and AI-powered driver coaching that sharpens decision-making behind the wheel, and the integration of HAS safety alerting to ensure community members are aware of an emergency vehicle that may engage in their travel path. Advanced trauma care pushes capability further. Through point-of-care ultrasound, modern trauma supplies, full health data interoperability, and strengthened medical direction that keeps our agency at the forefront of clinical innovation, we're improving outcomes for patients across the community when minutes matter most. At the heart of this initiative is our blood program. Since launching last year, we've saved 9 lives across the North Penn and Indian Valley communities. 9 patients who, without pre-hospital blood, may not have survived their hemorrhage. This grant allows expanding access, meaning more units in more places, and more chances to bring someone home when every second of blood resuscitation means a stronger chance of survivability. Together, those first 3 initiatives strengthen what happens before arrival, on scene, and on the way to definitive care for our citizens across the North Penn and Indian Valley. Just as important, this initiative protects the people who answer the call. The work we do is demanding, and the toll it can take on responders is real. We believe taking care of our crews is just as critical as the care they deliver, and this initiative is how we put that into practice. At the center is a full-time professional mental health practitioner dedicated entirely to responder wellness. Alongside expanded training in post-trauma resilience, a fatigue monitoring study, and psychological safety built into how we lead, this is how we make sure our crews stay ready when your family needs them most. North Penn and Indian Valley deserve more than a fast response. They deserve a healthier community. This initiative launches an innovative mobile integrated health program, bringing proactive care into homes, following up after emergencies, and connecting our most vulnerable neighbors to the resources they need before a crisis ever takes shape. We're pairing it with deeper community engagement, a dedicated outreach team, public education, and enhanced integration in our internal dispatch center, because real prevention is out in our community every day. That means better outcomes are not limited to the moment of response. They extend into recovery, prevention, and stronger support for people across our community. The final initiative keeps the work accountable. We track performance, measure impact, and use real data to guide decisions and show measurable progress that we will report back to the VMSC community. Together, we are advancing 6 connected priorities for the broader North Penn and Indian Valley community: a trauma-ready workforce, safe response, advanced trauma care, responder health and safety, community health and prevention, and the performance and long-term sustainability needed to deliver lasting impact. And from the start, this plan is built for long-term sustainability, with partnerships and funding strategies designed to deliver lasting benefit across the VMSC community long after the Safe Streets for All grant period ends. Thank you to all municipal leadership and our greater community members for your partnership. Together, VMSC and the North Penn and Indian Valley communities will build safer roads, stronger response, and better outcomes for the entire community.
That's good, right? Back here. No, we're really excited about the Safe Streets for All initiatives, right? And I think you're going to start seeing some really noticeable things that we're working in the community. As I alluded to earlier, if only 8% of the responses are really we need to get into the hospital, we've identified that probably nearly 40 or so percent don't need an ambulance at all, right? So how do we connect people to the right care at the right time, right? Should we be sending the most expensive mode of transportation to the most expensive location for healthcare, an ambulance and an emergency room, when oftentimes they just need access to, a physician, right? They're a doctor. So we're working on initiatives through mobile integrated health technologies, telehealth, and so forth, to ensure that if our ambulances are not tied up on the low acuity things that maybe not necessarily need an ambulance, it can be more readily available for those 8% of calls where we absolutely need an ambulance in a hurry. And that's how our strategy with the Safe Streets for All initiative is, and how we're going to use some of that technology. We also understood during the snowstorm, I was beginning to doubt your weather up here, that you really got snow. But this year really taught us a lesson, right? We don't have a lot of access for four-wheel drive, vehicles. That's a vulnerability we now own. And I'm happy to report that funding initiatives through this SS4A will put 4 four-wheel drive ambulances into our North Penn community. So, and one of those is going to be right over here. So the first 2 will be delivered next month, and then after that, we'll have 2 more later in the year. So really excited that we'll have the additional four-wheel drive, a little more security for our residents, that we're going to get to you, and we're going to get you to where you need to go to. So I think, is that it? So happy to answer any questions. And I just want to again express our sincere gratitude from myself and roughly the nearly 400 people at VMSC Emergency Medical Services.
Thank you, Chief Wheeler.
Thank you.
So I don't know if you know this, but back in the day in my hometown, I was a volunteer on a first aid squad.
Okay.
It was really meaningful, and enjoying all the training opportunities and learning life-saving and CPR. It was a wonderful experience for me. And I just wondered, though, reflecting on my own, volunteerism there, how many volunteers do you still have, or have you transitioned now to mostly paid?
Yeah, we're 99% paid. Our search and rescue team, the canine team, is really they're all volunteer, and they were out yesterday. Right? They were involved with the search, had a poor outcome, but the training of those canines and those teams are remarkable, and they've been leveraged to Philadelphia for searches. The U.S. Marshal Services utilize them. They've come a long way from where they were a few years ago to where they are today. They are just remarkable. Uh, Animals, and the handlers are great. We have a handful of paramedics and EMTs that still come out and volunteer, mostly though for event standbys, high school games, and football games, and so forth. But the volunteer side of the EMS has been a real challenge. It's so labor intensive with the training and upkeep. A paramedic course right now is sitting just with clinical rotations and so forth, pretty close to 2,000 hours to complete, and the training is about $14,000 to get the paramedic level of certification. So it's an evolution, and people expect the highest level of training and so forth to respond. And I came through a volunteer system myself and grew through that. And I think it's a wonderful. We should always provide opportunities for people to volunteer if they have a desire to do so, and I think we'll continue to do that. But for the most part, most of the staff are career.
Are there questions and comments from the board? I would also add, in the last year, I had to respond to my house. My husband was having an issue, gotten lit up by some ground wasps, yellow jackets, and he had a response to it, if you will, a vasovagal syncope episode, if you will, and passed out. So we were really, really worried about him, and you guys were right there on the spot. I mean, really quick to respond and took good care of him. So I can't thank you enough for the care that you've provided for my own family and our community as a whole.
Yeah, what Montgomery Township and every municipality that we service provides some level of financial support for the organization, right? Um, what Montgomery Township does for its residents to ensure that there's the cost to help lessen the burden for readiness, right? It's the insurance carriers would argue it's not their responsibility to ensure that you have an ambulance available. They just pay for the transport. It's the local governance, which you guys have showed great um, just leadership in, has demonstrated that it's that cost of readiness. So when that emergency does happen, that you get a quick response. So we're proud of the relationships we build with our municipalities.
I have a question about I'm very excited. Thank you for all that you do, by the way. With the four-wheel drive options, and how do you know which one to dispatch? I mean, what kind of questions you take so that you know whether they need the full outfit of an ambulance versus a smaller, more agile
Vehicle. Yeah. So there's a triage method on the
Mm.
call takers. We're not going to just not respond on all the calls. We're still going to do that, but it'll be just how we respond. We'll change up. The community paramedic will go to more the low acuity, the pain call, all the I need, can you check my blood pressure? Okay, those kind of high utilizations. They'll be dispatched automatically with an ambulance on all falls, because we want to get fall education in place in those households, and also do a safety inspection to make sure that are there social determinants to health that we need to address to make sure that this doesn't happen again. So there's a triage processes. We use some artificial intelligence that helps us with that decision making, which is pretty amazingly accurate. And our goal is to outfit all of our 911 resources into four-wheel drive ambulances, so that it's just that's our capacity. That it doesn't matter which one you call, we're going to get you to that location. And we're currently working out those particulars to do that. The 4 units would pretty much all but one of the ambulances in the North Penn area would be four-wheel drive, and that's one that would be based in our current main location there at the hospital. But The goal would be to get all the vehicles to the same level of capacity.
Thank you.
Just a comment. I said it last year. I'm going to say it, or last time you were in front of us. I'm going to say it again this year. Thank you for everything, especially what's helping out in Chester. It's
Sure.
significant for me personally, from a family that's there, and just not having the resources due to the hospital situation. So thank you for your entire team. I was actually out there last week visiting my mother-in-law's grave, and saw a VMSC truck, not rushing anywhere, just was there. So, but it warms my heart to see that, because I thought of you right away. And so again, thank you. You said this quickly, but what does STEMI
Yeah,
stand
sure.
for?
ST elevation,
Okay.
myocardial infarction. So if you're looking at an EKG strip,
Mhm.
the ST is a part of they QRST. They all have the point. So
Okay.
an ST elevation is indicative of a myocardial or heart attack.
Okay.
So that's what STEMI stands for. And just so you know, I think we ran just under 9,000 responses in Chester City last year. A lot.
Yeah.
They're very, very
Believe that.
busy.
Yeah.
For sure.
Wow.
Thank you.
There's a need.
Absolutely.
Comments or questions?
Thank you all.
Absolutely. Thank you again for the opportunity to present tonight.
Thank you. It was a pleasure having you.
All right, thank you.
Yes, we'll join. Thank you, Chief.
Yes.
Thank you.
Thank you so much.
And anytime you want to come on by, we're going to be opening up hopefully the Hatfield former police department, which will be our
Oh, yeah.
new
New
digs.
digs.
In June or July, we're going to have an open house.
Ooh.
Oh, we'll be there.
Alright.
Yes.
Okay, moving on to our next agenda item, item number 6, review of zoning hearing board applications. Carolyn McCreary, Township Manager.
Thank you. Included in your packet is a summary of the applications that will go before the zoning hearing board on May 6th. The board can remain neutral on the applications and let the zoning hearing board render a decision, or they can send the solicitor's office to oppose any application. There are 2 applications that are going to be presented. The first is for 309 Autovest Properties located at 1009 Bethlehem Pike. They are seeking a variance for a sign they want to put in. 70 square feet is permitted. They're looking to put in 104 square foot signage. And then there is a residential application on Walden Lane. The applicant is seeking to put in a single floor addition, and they need several dimensional variances, including front yard setback, existing yard setback, and also street side yard setback. So that's what's before the zoning hearing board, and then the board can decide whether you're going to let them hear it and base the decision on what's presented to them, or you want to take a position and send the solicitor's office.
I was a little concerned myself in this second application on Walden Lane, and it doesn't seem like these are de minimis, and there's like 3 different, I guess, variances that they're seeking for this addition. Do you and staff have any concerns about that?
As far as, you're correct, they're not de minimis, and typically the zoning hearing board, they will grant a variance of something like this if it's because of the nature of the property. If you're creating your own hardship, you wish to put something in that just doesn't match the property that you have. In this case, I believe they're a little bit over a quarter of an acre. The zoning hearing board has all the right to say, no, you've created your own hardship, come up with a different size addition. I've shared it with, staff has looked at it. Our current interim zoning officer, who's also going to be our planning and zoning director, will appear before the zoning hearing board and speak to those issues with it.
But it's not your counsel or advice to go in opposition of this?
I guess I'm concerned if the township starts interjecting themselves in residential decisions, then we've set a precedent. In this case, I mean, 800 square feet addition is not onerous in and of itself. I could see them telling them, 45 feet, you're asking 10 is the minimum. they might give them something a little more than 10, but I think 45 is excessive. And I believe that's what Mr. Hill will express to them as far as his appearance at the zoning hearing board.
So are you comfortable then allowing the zoning hearing board to decide this on their own?
Yes, based on the testimony that the zoning officer will give, I believe they can make a decision.
I can support that.
Out of curiosity, there's a current dwelling there, and this would be in addition to that.
Correct.
Do we have the square footage of that dwelling? I don't see that written here.
No, I do not have that.
Okay.
Probably 18 or 1900 square feet,
I,
current house.
okay.
I'm sympathetic to what people are dealing with right now in terms of, the lack of available, attainable property, especially for young families. I don't know what the purpose of this addition is. But, I am sensitive to the fact that, a lot of times an addition is the only
Mhm.
way for them to be able to accommodate an expanding family, what have you. Anyway, as long as you don't have concerns about this, then I'm comfortable allowing the zoning hearing board to make that decision. Would everybody concur?
Yeah, I concur.
And I can certainly share your thoughts with the zoning officer so that he's aware of that, you don't want to interfere, but at the same time, you want to be respectful of, we've had a situation,
Yeah.
Where and as a result, we looked at our zoning ordinance and said, okay, we need to make some changes so that we don't have basically a second home being constructed on a lot. In this case, you're looking at, if it is in fact 1900 square feet, it's not the same, obviously, 800 versus another 1900, but I will tell them that you're concerned about the variances and the impact it might have on the neighborhood.
And their neighbors will be notified, correct?
Yes, they will. And everybody, I forget, but it's definitely within a certain square.
500 feet.
Thank you.
Okay. I think we're all set on that one. Next, under planning and zoning, we have a request for waiver of fees. The Refuge Church in Montgomery Mall, Carolyn McCree, Township Manager.
The township received a letter dated April 10th from Josh Crum, who is pastor of Refuge Church, requesting the township consider waiving the fees for the associated permits required for a building permit and a use and occupancy permit. The board has waived permit fees for other nonprofit organizations in the past, and the fees for this were calculated to be $350.
Any comments or questions from the board? All right, I'll move to waive the fees associated with the building permit and use and an occupancy permit for the Refuge Church. Is there a second?
Second.
Any public comment? Hearing none. All those in favor say aye. Aye. Any opposed? Motion carries. Moving on to Public Works. We have agenda item 8, authorization of the purchase and installation of magnetic locks at Spring Valley Park and William F. Mall Park at Windle Strait. Greg Reef, Public Works Director.
Good evening. The 2026 capital investment plan includes the purchase and installation of programmable magnetic locks on the men's and women's room restroom doors at Spring Valley and William F. Mall Park at Windle Strait. The magnetic lock installation will be an upgrade at Spring Valley and a new installation at William F. Mall at Windle Strait, which is currently open 24/7. The new locks will provide stronger security, allowing them to lock and unlock at specific times. The hope is that the stronger security will help deter vandalism, requiring the restrooms to remain closed until repairs can be made or professional hazmat cleaning can be performed. Attached are the quotes dated March 5th of 2026 for My Lock and Safe LLC for a total cost of $11,800 to complete the men's and women's room doors at both Spring Valley and William F. Mall Park at Windle Strait. A total of $11,200 is included in the 2026 capital investment plan for the purchase and installation of the programmable locks on the men's and women's restroom doors. So our recommendation would be that the Board of Supervisors approves the purchase and installation of the programmable magnetic locks on the men's and women's room restroom doors at Spring Valley and William F. Mall Park, Windle Strait.
What are the planned lock and unlock times?
It'll probably, Windle Strait will be a little bit different than Spring Valley. Windle Strait will probably follow, I'm going to say, the schedules of when the sports teams are going to be
Baseball, yeah.
there, correct, because of the lights. Spring Valley Upper, it's probably going to be the dusk to dawn.
Yeah, I would
This-
hope this would keep some of the vandalism away.
We're hoping.
Yeah.
We're hoping.
Okay, thank you.
Do they have a capability to just say someone called in and said, oh, there's a situation going on at the bathroom. Could you, away from the bathroom, do something to lock it immediately?
That's what Rich was looking into,
Okay.
just to make sure that these would be programmable from our phones,
Okay,
basically,
right.
so that we would be able to lock it from any
Should something
location.
occur? Okay.
Good question. Okay. If there are no further questions or comments, then I'll entertain a motion to award the contract for the purchase and installation of programmable magnetic locks on the men's and women's restroom doors at Spring Valley Park and William F. Mall Park to My Lock and Safe LLC at a total cost of $11,800 per their quote dated March 5th, 2026. So moved. I entertained it. Yeah.
So moved.
Is there a second?
Second.
Any public comment?
Sir, you need to come forward and
My question, okay?
Yeah.
What is this vandalism that's happening there? Have there been arrests made? Are there cameras watching for these people? I mean,
There's not cameras. It's been fecal matter that's been spread throughout
real
the.
fast.
I'm sorry. Sorry.
No,
It's
I know. I mean the vandalism. You know, it's just.
and that is a form of vandalism. So that's
I know this is-
so that's.
But these people need to go to prison. That's all I can say.
Is there any further public comment? No? All right, hearing none, I'll move to award the contract. Oh, no, wait. I already moved. It's been moved and seconded, and all those in favor say aye. Aye. Any opposed? Motion carries. Okay. Agenda item 9, authorization to advertise for bids to upfit a 3-point hitch front PTO and snowplow for John Deere 612 or 6120 tractor. Greg Reef, Public Works Director.
Okay. The 2026 capital investment plan includes a purchase and upfit of a 3-point hitch front PTO and snowplow for the 2018 John Deere 6120M tractor to make it more versatile and suitable for snow removal. Our 2004 New Holland tractor is deteriorating and becoming obsolete, making it increasingly difficult to obtain parts for repairs. The upfit of the John Deere 6120M will allow the snow blower from the New Holland tractor to continue to be used and will allow the tractor to run from the front for snow removal operations. The work for this is specialized and will need to be completed by a dealership capable of working on large agricultural tractors. Although the closest dealership is on contract, unfortunately, the services are not covered unless we are purchasing a new tractor. Therefore, a formal bidding is required due to the cost of the work exceeding the bidding thresholds. Gilmore and Associates, a township engineer, will solicit competitive bids utilizing the PennBid website. A total of $36,000 is included in the 2026 capital investment plan for the purchase and upfit of a 3-point hitch, front PTO, and snowplow for the 2018 John Deere 6120M tractor. So our recommendation would be for the Board of Supervisors to approve the authorization for the advertisement of the bid.
Any comments or questions from the board? Hearing none, I'll move to authorize the advertisement of the bid for the purchase and upfit of a 3-point hitch, front PTO, and snowplow for the 2018 John Deere 6120M tractor utilizing PennBid. Is there a second?
Second.
Any public comment? Hearing none, all those in favor say aye. Any opposed? Motion carries. All right, moving on to administration and finance. We have agenda item 10, a resolution supporting the DCNR grant application for the meadow conversion project at Memorial Grove. Carolyn McCreary, Township Manager.
Thank you. The next round of applications to the Department of Conservation and Natural Resources Community Conservation Partnerships Program is open, and the applications are due April 30th. An application has been successfully started and acknowledged by DCNR pertaining to Whistle Stop Park. The EAC has been working to develop a plan to reduce mowing on township properties, and they are proposing to convert some of the existing lawn at Memorial Grove to a meadow. The township has successfully applied for grants in this program for both Fellowship and Whistle Stop Parks. We're also currently working on our application for playground improvements at Autumn Woods Park. The estimated cost of the project is $100,000, and the grant we are seeking is $50,000. Staff respectfully requests that the Board of Supervisors adopt the resolution to support the grant application. And the EAC is meeting tomorrow to expand on their original thoughts so that we can get the application, and it's due by 4 o'clock on Thursday afternoon.
That's right. I will actually have Judy Stark Goldstein here to attend the EAC meeting tomorrow to give us some guidance on this project, which would be a 3-year project. This is not a 1-year project. Something that would span everything, this lawn to meadow, native meadow with seeds, but it requires grass removal and tarping, meadow installation, and maintenance. We'll have to have equipment rentals, et cetera, and also signs for educational purposes, because we really want this to expand into people doing this at their own residential properties as well. Something that we can decrease the amount of lawns that are being cut, which sounds like, oh, that seems like a really simple process. It's not as simple as you'd think. So I've seen commercials where they're like, oh, just put your meadow seeds on your lawn and it will grow a meadow. That is absolutely not what will happen. So there's a huge process involved. The more you learn about it, you realize how complicated this can be. And we're going to be getting some guidance from our engineer and from Judy, and hopefully our EAC can manage this. But again, it's a 3-year program that we'll be attempting. So.
Any other comments or questions?
Sure. And I will also say this, if we feel as if this is, maybe beyond the scope of what we want to tackle at this point, we will also, there's no guarantee that we have to go forward with the grant even if it is extended to us. Is that correct?
Yes, that's correct. The only thing I would say is if you're awarded the grant, you would be notified in October, November, so then we could include our match in the next 3 years, because the grant is good for 3 years. Generally, you don't want to turn a grant down if you get it, because you don't want to have a little asterisk next to your municipality, so that if you apply in the 27 cycle,
pulled away.
Right. So I would say you had the best idea. Plan for it over 3 years.
Plan for it
because
over
there is
3
more
years.
to it. There's also the controlling of invasives. So there's going to be sort of a cooperative effort between obviously the EAC, Public Works, and Judy being the landscape architect can help guide us and making sure that our signage is correct and that we promote it so that it's sort of an opportunity for people to see a successful implementation and realize they can do something like that in their own property if they choose to.
Right. Everyone should spend less time mowing. So, and
The,
watering their and looking for opportunities to do so in their own properties as well as our within the township as well.
Do we know what the size of that particular area is that we're planning for the meadow?
I think it's more than an acre. I know that, but we aren't planning to do a full acre. We're planning to do a portion of it and then to expand it each year. If you bite off more than you can chew, you probably will fail. So we're going to start with a certain amount, and I don't have all the specifics on it, but a certain amount, and then expand it over the 3-year period.
I was just curious because you can be based on the size of the I guess parcel where we would plan this meadow. You could quantify the man hours saved in mowing over time and the fuel cost, et cetera. So that this
It's an astounding amount.
ultimately sort of pays for itself in savings
Correct.
associated with not having to mow that area any longer.
Correct. Absolutely.
the estimated cost of the project, is that over the course of the
Correct,
3
the
years?
3 year.
Full 3 year.
Full
Okay.
3 years, yes.
Any other comments or questions? Okay. I will entertain a motion to adopt resolution 2026-10 supporting Montgomery Township's DCNR grant application for the Memorial Grove Meadow Conversion Project.
So moved.
Second?
Any public comment? Okay. All those in favor say aye.
Aye.
Any opposed? Motion carries. All right. Moving on to old business, agenda item. Oops. I think I took too many over there. There we go. Designation of North Wales Area Library as the township's library of record. Carolyn McCree, Township Manager.
Jennifer Koch, who is the director of the North Wales Area Library, provided the board with an update on operations and initiatives at your last meeting on April 13th. She noted the number of residents who are members of the library and recognized the township's continued financial support for them. During her presentation, she mentioned that the township could further assist the library by designating it as the township's library. Mr. Pelletier requested that the board consider this request, and in order to comply with the Sunshine Law, the board consensus was to add this to an upcoming agenda for consideration. Tonight before you is motion is a resolution 2026-09, which would designate the North Wales Area Library as Montgomery Township's library.
So I just want to clarify that as we're becoming they're becoming our library, this is not forcing us to give them any more money or anything other than what we normally donate to them, correct?
That's correct. Your donation that you make annually is at your discretion.
Great, thank you.
What this does though is, it provides them with more funding through the state.
No, it's great if we can help them.
Yes.
That's what she mentioned.
I did have a question, and I don't know that it needs to be added to the resolution, but I know that some of the other municipalities who designated the library as their library have the ability to appoint members to their board from their communities. Is that something that needs to be in the resolution, or is that,
I think that would be a separate resolution for this board to consider. This is one that Jennifer provided to me that has been used by other municipalities. So I didn't want to deviate to do anything that might jeopardize their funding with the state. But if it's agreed that the Montgomery Township would have a member on their board, then we can certainly prepare a resolution. And then every year when you do your committee appointments, you can include whoever you're going to make the representative for that particular year. We can just make that part of your annual reorganization. But I think just to keep it clean, I'd like to use exactly what she presented to us that could be submitted.
I mean, we do currently have a member of the community on the board.
Yes, you do.
That would
But
be
I didn't know if that was because of our role as being part of them, or if it was because of your commitment to the library that they asked you to serve on the board.
No, the way that came to pass was the former library director, Jane Blackledge, had reached out to me to see if there was anyone from that I was aware of in the community who would have an interest in serving on that board. And, public libraries are near and dear to my heart. She probably didn't even know that at the time. I think she was sincerely just asking for a recommendation of someone we might know in the community. But as it happened, I stepped forward to volunteer at that time. And I currently serve as the president of that board. So, I know that they asked, though, because there was someone who was outgoing, who had left, resigned from their board, who was from Montgomery Township. And they were themselves, even though it's not stipulated in their bylaws that they needed to, because we are one of the primary communities they serve, they felt like it was important to have that representation on their board. To formalize it, though, if we designate them, I think we could formalize that as a part of this process. So that we would have the right to appoint, and that would serve future boards, when I'm no longer here, long after, I've stepped down from this role. So Any other comments or questions as it relates to this? Okay. Should I read the entire resolution? Or just,
I don't think that's necessary.
all right. For the sake of brevity, I'll just move to adopt resolution 2026-09 designating the North Wales Area Library as Montgomery Township's library.
Second.
All those in favor say aye.
Aye.
Any opposed? Motion carries. And let's see, moving on. I'm so sorry. Please.
Michael Wajny, and I don't think you should have voted, Tanya. There's obviously a conflict of interest. So you should have abstained yourself just from an ethical standpoint. That's just my opinion. You should have taken that into consideration.
Solicitor Kilkenny, would you like to weigh in on this?
What I would suggest is, because we didn't have public comment on this issue before this, what I would suggest is a revote, and an abundance of caution, you recuse yourself.
Okay.
Chair Ray.
We're going to vote again. And this time I will abstain from the vote. Do I have a motion to adopt resolution 2026-09 designating the North Wales Area Library as Montgomery Township's library?
So moved.
Second.
Any further public comment? Hearing none. All those in favor say aye.
Aye.
Any opposed? 4 in favor and 1 abstention. Moving on to new business. Oh, hold on.
One more. 12.
New business. It's under new business.
Oh, sorry.
Adoption of the National Wildlife Federation's Monarch Pledge. Carolyn McCreary, Township Manager.
The chairwoman received a communication from the National Wildlife Federation seeking the township's participation in this initiative regarding the Monarch Pledge. Specifically, it noted, quote, "With our nation's migratory monarch butterfly populations dwindling, leaders like yourself hold the key to rallying our community around critical conservation efforts that can help this imperiled pollinator. The mayor's Monarch Pledge provides a proven framework intended to provide efforts or to support efforts to create and expand habitat for monarchs and other wildlife where people live, work, learn, play, and worship." End quote. The EAC will meet tomorrow on April 28th and discuss what action items the township can reasonably accomplish by December 31st. The pledge survey will then be filled out and submitted to NWF. The EAC will be tasked with tracking our progress and reporting it to NWF by December 31st.
Any comments?
The only thing I will say is, I took the time talking to Carolyn about this, looking at what is on this list. We're doing a lot of this anyway. I think I don't want to say this is going to be a light lift for us. I don't think it will be something that will be a huge effort on our part, but it will keep it front of mind as we are doing things in the township, that we have to think about our pollinators and our monarch butterflies and so forth, even more so. And why not put it out there so that also, in terms of leading by example in our township, that people can take the same steps, hopefully in their yards and gardens as well.
Any other comments or questions from the board? All right. Hearing none, I'll entertain a motion to participate in the National Wildlife Federation's Monarch Pledge and complete the survey officially designating Montgomery Township as a participant.
So moved.
Second. Any public comment?
Mhm.
Hearing none, all those in favor say aye. Aye. Any opposed? Motion carries. All right. Department reports. So the township staff has prepared reports for the month of March. If there are any questions, the department directors will be available to answer them at the public meeting. Additionally, this is an opportunity for staff to bring any items or issues of interest to the Board of Supervisors for which they need input or direction. We had a presentation earlier from Chief Wheeler from VMSC, and that's going to be the official staff report for this meeting. But if there are any further questions that any of the members of the board have, please share them at this time. Any other questions for any of our department heads?
The only thing I'll ask our Public Works Director, we get very common, frequent questions about the dog park. We talked about this earlier, and I know that hopefully this could answer some questions from residents who are interested about the timing, and that we don't have full control over this as Mother Nature is, but I wanted to at least let people know that we are aware of how popular our dog park is, and if you could give us a quick update on, which may not give exact dates, but let us know how things are going.
Sure. The dog park, I'm going to say we're getting close on opening. Again, we've had a lot of issues with the grass establishing with the winter that we had. Same way with the areas being overly wet. The harder use they get, they're just like a sports field, basically. The harder they get used early on is what you're going to have to deal with farther into the season. So last year with the drought it was a huge problem for us along with everybody else. Then this winter with all the snow and the ice definitely didn't help us out. And then we got some warm temps early on where we did get some grass seed out there. We had grow tarps out there. But then we had that rapid warm up. So we had to remove the grow tarp so that the grass didn't burn off. So it's just been, it's been a roller coaster. We really hope to have it open soon. One of the other issues that we've had out at the park, since we have the 3 areas, we have the rotational area. The rotational area, we were moving almost every week, or depending on how the grass was doing. People weren't paying attention to anything that we had out there. So they were breaking into the other park, which further delayed things for us for the maintenance end of things. Again, we're just waiting for the grass to get established. We do have a lot of new grass coming up. We're always looking at different things to see how we can change things up just so that we can have it open. I'm going to say earlier, but you know, our hands are a little tied on this. I know we're getting a lot of phone calls about this park. We want to have it open as much as they want it open. So it's just kind of, I'm going to say, weather depending.
And we appreciate all that you're doing and have done and continue to do for this dog park. I know we're very fortunate to have a free and open dog park to our community and adjacent communities. And I think we're lucky to have that. I just hope that we can use this time as an investment into a more successful season. And hopefully we'll get occasional rains that are light and allow for the growth and not destruction.
The park is heavily used.
Yes.
It really is. That park is heavily used, which is a good thing, but it's also a bad thing as well.
I think people saw the tarp come off and they said, oh, that means it's going to open to, imminently. And I said, no, I think it just got too hot.
Not quite.
Got it. Okay. Thank you for that clarification. Hopefully
Yeah.
that'll satisfy some people's curiosity.
Okay. Any other questions for staff before we move to committee liaison reports? No? Okay. Who would like to start?
I'll start. There was no planning commission meeting.
Microphone.
There was no planning commission meeting. There was no shade tree meeting. We did have a very successful tree giveaway on Saturday. Everyone got their red buds who wanted them. Very, very good day.
Wasn't too rainy?
No.
No. Okay.
It
was cold.
Yeah, it was cold.
People were still in line.
Yep. Wonderful.
Community Rec Center met, community meeting met, pretty successful over there. Programs are full. Kids University filled within 5 minutes or something. It was very quick. So things are running pretty well up there. A couple of things that are, well, one thing that's going to come up in the next year or two is necessary replacement of the treadmills, et cetera.
Mhm.
And that's a pretty large expense coming up, just keeping it on everyone's radar that's
Mhm.
one member of the committee asked about purchasing refurbished units, and that's a liability issue. So we need to purchase new stuff when we buy that. So that's where we are with that.
So the sewer authority met, and a couple of updates are that they recently completed their security systems upgrades. So that was great news, and they are in the process of switching to a UV disinfection system, transitioning away from chlorine. So they're in the midst of that project right now. But this is a really important transition for them to make because chlorine can be really dangerous for the staff to work with, and storing it, has some challenges. So it's both more environmentally friendly in terms of that disinfection process, and it's also safer for staff. And they wanted to make sure that we recognized our elected representatives who helped them obtain grant funding for that project, including Representatives Steve Malagary and Melissa Serrato, as well as our State Senator Maria Collette. So thank them all for their support in obtaining the grant funding for that project. Business Development Partnership met, I believe, but I was not able to attend because I was at the PSATS conference in Hershey, along with two of my colleagues here. And I will say that that was a really wonderful conference. As always, that's the Pennsylvania State Association of Township Supervisors, and they host an annual conference out in Hershey. And it's a wonderful opportunity for us to network with other officials, township supervisors from across the state, and compare best practices. I actually moderated 2 sessions while I was out there. One on fire services expansion, which is a subject that's near and dear to our heart here. And that presenter, Chief Brett Graham from Lower Paxton Township, gave a great presentation, and advising, as we know, that volunteerism is waning and that you need to prepare for the transition to combination and ultimately full-time 24/7 paid coverage. And he advocated using a very data-driven approach in this process, and really spent a lot of time reviewing the metrics for that. The other panel that I moderated was on fees under the MPC, and how your requirements to publish all of your fees, and the guidelines that are in place in terms of how those fees can be developed, because townships are prohibited from making money. So this can, it has to be sort of a net zero from your fees. Townships this isn't like a profit revenue generator for townships, but you can actually recoup your costs from providing certain services. So I thought it was all very well done. Great conference.
Agree. We had a very busy month this month for the Environmental Advisory Committee. Not only helping out with the tree giveaway, doing some demos on how to do some pesticide-free mosquito controls to those who came and picked up their trees. 250 were given out. We also had a day, which unfortunately the weather didn't cooperate for us so much in the afternoon, but a park cleanup that wasn't as successful in that no one came. But we did have a garden demo, which people stopped by to learn a little bit about the small native pollinator garden we're putting in over by the rec center. Then we showed a movie, The Extraordinary Caterpillar, and followed up with a little eco-friendly craft for the kids. And I actually took a bunch of pictures of that. I should probably send those over so we can talk about that, because there's some cute kids there. So why not brighten people's day with that? So it was a very successful day overall. We will be meeting again tomorrow to talk about not only the grants and the Monarch Pledge, but also going over best practices and what we can do better for next year with our Earth Day activities. So Lots of good stuff here for Earth Day.
And my senior committee, so I was not able to participate at the meeting, but we also had right behind it a meeting, our first meeting, and it was really more of an informational session. We want to start a little walking group. And so we had some folks that came out to share their ideas and best practices on what we can do to establish a walking group with our seniors, actually anybody, but focus being on seniors. So we, again, I was not able to participate, but followed up with my seniors afterwards and found out that we are going to have another session because there's about 2 or 3 things that we feel like we just want to get more input on. And so we're going to meet in 2 weeks. Actually, it's a little under 2 weeks. Just to kind of iron out, but very informal, but yet formal. So, we're looking at no more than 2 right now to start days a week that we get together. So the big scuttlebutt right now is what time
For walking.
to just start walking. And also the chain of communication. So how do we get out if it's raining and we say, okay, we're going to go meet at the rec center, or we said like once a week we would do a specific park and then change, the next week. So how do we get our communication? So those are just a couple of the topics that are still up in the air, but they're excited about it. I am too, to be honest. So that was it.
Supervisor Ware Jones, has the senior committee ever done something, giving a nod to the presentation earlier this evening from Chief Wheeler? Has senior committee ever done a fall prevention program?
You have.
We have. It's actually a topic that comes up often in the senior committee.
And repeats
So
itself.
and it does. Right. So we actually, one of our board members is one of the members on the senior committee actually does physical therapy for in-home. We'll come to, and his focus is on
vestibulars.
Exactly, and being able to, hopefully ward off any type of falls. But he just gave his presentation, if I'm not mistaken. Forgive me.
It was recent.
It was very recent. But he's an annual presenter that we have around that topic. Yeah, absolutely.
It's got to be a subject that you're well acquainted with as well.
Well, my wife and me.
Yeah.
Babies don't fall.
Okay, I have one more, if I can have a sec. I'm just thinking about our manners. We're spending $11,000 on locks for our bathrooms. We've all lived here for many years. I've been here for 33 years. It's sad that we're having to put new locks on the bathrooms. And I just think maybe moms, dads, grandparents, people watching, just let's remember our manners. If the dog park is closed, it's closed for a reason. Stay off the grass that's trying to grow. And remind your kids, like, it's your tax dollars that are paying for these things, that are paying for the bathrooms, that are now paying for the new locks that we need, that will pay for the cleanup of the vandalism that's happening. Let's just remind our kids, school's going to be over soon. Kids get bored. Just let's try to remember that we need to have manners in public and take care of the things that we're lucky enough to have in this township.
Thank you, Supervisor Camara.
I agree.
Is there any other business to come before the board at this time? Hearing none, I'll entertain a motion to adjourn.
And go Flyers.
So moved.
So moved.
And go Flyers. Second. All right. Meeting's adjourned. Thanks, everyone. Have a great night.
I was thinking the